And we are live. Welcome, everyone. Welcome. My name is Casey Pacheco. I am the host of this podcast, Meet the Experts. And we have a beautiful expert here, Dr. Louisana Lewis. Welcome, welcome. So, Dr. Lewis, we are here. I'm just going to give a brief intro about what this is all about. So, Meet the Experts is a podcast where we sit together and we sit down with these powerful voices who are reshaping our world today. They are coming with their passion, their purpose, and their impact. Today, I am so honored to have Dr. Lois because she is nothing short of a force in the field of mental health and well being. Welcome, welcome, Dr. Lewis.
Thank you so much, Casey, and thank you so much for the honor to be among greatness. Her name is Casey Pacheco, and also for the invite. And I'm so honored to be here. It's really, really a pleasure. Thank you so much for allowing me to come onto your platform and for recognizing me, right? Greatness
Absolutely.
recognize greatness.
I agree with. Thank you, sis. Thank you. And I'm just going to share with the audience a little bit of your background so they know that you know what you're talking about and just so they could see what you have done in nursing so far.
Of
So
course.
Dr. Lois, she has 25 years of experience in healthcare. She's a board certified psychiatric nurse practitioner, an educator, and the founder of Prestige Health and Wellness. She's not just providing care, y'all. She is revolutionizing how mental health is perceived, delivered, and experienced. She's also an instructor. So, whether she is in a classroom at Florida Atlantic University or she's an entrepreneur, so whether she's either in the classroom or in the clinic, she is providing holistic, culturally responsive care. And she also sits on the board for the Florida Center for Nursing, and they are doing an amazing job looking out for our nurses. Dr. Lewis, she also sits on the board of St. Anthony's Hospital, and I don't know where she finds time to do it all, but just remarkable. She is pushing the boundaries with grace, insight, and leadership. I'm going to read it exactly. Her mission is to humanize mental health, uplift communities, and mentor the next generation of nurse leaders. And I want to be one who is mentored by her. So let's hear what she has to say. Dr. Lewis, thank you for joining us, and we are excited to hear what you have to say. My first question is actually based on your mission to humanize mental health. Break it down for us.
Oh
What
my
is that?
goodness gracious. Well, thank you so much. And humanizing mental health is just so important to me. It is the backbone of what I desire to
Mhm,
be when it comes to mental health. Humanizing is seeing people beyond their diagnosis. It's
mhm,
taking the time to say, I see you, I hear you, and you matter. That alone can be healing when you first have your first encounter with whatever space that you get your healing from. In practice, what that looks like when
mhm.
you enter the office, you already have a sense of calm. And
Ooh,
that is from the entry door all the way to the back door, right? The room itself,
mhm,
you turn off the light, because
mm.
lighting disrupt, right?
Yes.
That allows the person to feel a more calm environment. If you, we need to speak your native language, right? So that you feel
Mhm,
understood. It's not about rushing through the visit. When I think about mental health, a lot of people like, oh gosh, I only saw the psychiatrist for 20 minutes, 30 minutes,
mhm,
and nobody heard me. Where no, we take our time here. Okay. We never rush our follow ups. I've had appointments that have gone over an hour and a half. If I have the time, I will provide it. But what really stands out for us is that we serve the whole entire family, not just the patient, right? Because mental health affects everyone connected to the individual. So, you know, quick example, if I have a parent and the parent is the foundation, if the parent is not where they need to be, then it's going to be hard to raise those children and see the results they desire. What humanizing mental health means that
Mhm.
a parent or a person cannot pay their copay, we say, don't worry, we got you. It's offering a hug when someone needs it, if they are open to it. It's
Mhm.
texting back, it's following up, it's celebrating a birthday or the small wins as your patient make progress, because those matter too. At Prestige, we treat our patients like they're a family because they are, and in a healthcare system that often feels cold and transactional. Creating that emotional warmth and safety is everything, and that's where the healing starts.
You know, Dr. Lois, this is absolutely beautiful. You are an angel. You, as the CEO of Prestige, when I saw, so you, where we intersect is actually one of your offices or in my community in Polk County. And when I saw Polk County Community Assessment Report come out, and the community assessment, just for our viewers, every community has an assessment for their healthcare needs. So they take a bird's eye view of what are the people in the community really needing. And high on the priority list was mental health, access to mental health. And so I wanted to really highlight because as nurses, we love to help, but we a lot of times we're working so hard in the background. No one knows what we're doing, and they don't know the amazing services that are being provided. So I call Dr. Lewis. I say, I want you. I want to spotlight you because a lot of people are in panic and they need resources.
Mhm.
So what you're doing at Prestige is nothing short of a miracle. And I want people to know not just what you offer, oh, there's another mental health clinician, but how you offer it, the holistic aspect of your work.
No, and I'm so grateful, right? Because sometimes we forget the human that is in that space. You know, mental health is not a regular doctor visit, it's different. And we have to honor that difference. So I often, when I meet my patients, when they walk through the office, I let them know that we're comprehensive because the mind controls every organ in the body. And sometimes, right, we need to figure out how you are in a holistic space. We're
Mhm.
not going to just run to medication. We're going to do everything we can and give you what you need first before we even talk about medication. And if medication is what we need, then medication is not what we need, but it don't have to be the first thing we go to. So
Mhm.
that comprehensive holistic approach to mental health requires that we hear you, we, listen to you, we get to the root cause of the issue. Because if I don't get to the root cause of the issue, then I cannot provide a plan of care to meet the needs that are beyond medicine.
Amen. Amen. I know I know what you're saying resonates with a lot of our members of the community. I wanted to ask you, just because I'm nosy, you were in, you were a dean for many years. So you were in nursing education. And we
Yes.
get real passionate about this. But before we get into nursing education, I just wanted to ask what made you pivot from the role of education to mental health as a clinician?
No, thank you for asking. And sometimes I think about that, right? I've been through a lot in life that people don't know. You know, when you talk about going through valleys, my
Yeah.
valley has been so deep that it required God, the Holy Spirit, and everything in between to make sure that I was able to, when I could not walk, that He carried me. So I was a dean for many years and I love what I did. And I knew that God placed me there, but there was a bigger calling in my life.
Mhm.
And at 40 something years old, when I was kind of like hitting the peak of the mountain within academia,
Yes.
it was just something that was required of me. And I answered the call. And
Mm.
when I saw that the need was there and that I didn't like the way mental health looked,
Mhm.
I didn't like the way when I went into the hospital, how people were being treated, and one big one of the biggest things that pivot was sitting in my car with my 17-year-old daughter getting ready to go to UCF, getting ready to go to college. And she's like, Mom, in middle school, I wanted to kill myself. You you did not notice. You don't know how stressful life has been for me. I've been bullied. You just don't understand. And I say, I hear you and I'm going to understand. And that was the pivot.
Mm.
That was the pivot for me.
Mm.
Say, I don't want another person's child to
Yes.
have that experience because they feel someone was not listening or someone did not understand. So God put me in a path where I can bless other people's children and
Yeah.
let them know that somebody is there to hear them and someone is there to help them and help to transform their mind and know that they matter and that they're important.
So I just want to break this down a little bit because usually, we have this disclaimer where we say if you're experiencing any, depression, sadness, or any mental health disturbance, go see your provider. But
Hmm.
then someone goes to the provider and they leave feeling worse than they came.
Hmm.
Can you imagine this?
Yes, I can. I often tell my patients finding a therapist is like going on blind dates. When you go on, yeah, or those kind of dating where you go
Yes,
from person to person to find the match for you. That's
yes,
what therapy is. That's what psychiatry is. Because at the heart of psychiatry is that you need a human connection. And you
yes.
don't connect with everybody. You don't
Mm,
let everybody in your space because this is a space where you are at your most vulnerable state.
mhm,
And you need to
mhm.
be able to have that feeling I can trust you with everything that I release today, that you won't take advantage of me,
Yes,
that you're there to help me. That's a different level of vulnerability.
yes, yes.
So, it's like going on speed dating. And I say, people, don't give up.
Yeah.
We're out there. There's someone for you. And I know it's rough. A lot of people, when they have any mental health concerns, the first person that they approach will be their primary care provider. But we want people to be educated. It's not that the primary care provider can't start you on something, but the specialist truly
Mm,
lead and guide you to where you need to be, because they're not going to have that time to figure out what the root cause of the issue may be so that we can lead you away, because it may not require medication. I can
mhm.
get you to where you need to be before we even have to go on meds.
Ooh, ooh, powerful. Powerful. I could talk to you all day, but you got your hands in so many things. I want to talk to you about a lot of different things. And we're gonna fit this into 30 minutes. So if someone wants to reach out to you, Prestige Health, what's the best way for them to get to you?
Well, you know what? It's Prestige Health and Wellness, and we're in Florida. I know there's a Prestige Health and Wellness in New York, but they're chiropractic, and we're psychiatry, right? And if
Okay.
anyone need to reach out to me, it's easy to find me. You can email. You could go on the website www.yourprestigehealth.com, and you can reach out to us 813 2520171, and then we have our Lakeland. So any of those numbers, you can reach out. You can email me, right? If you need to reach out to me, you can email me directly, Louis at yourprestigehealth.com, or admin at yourprestigehealth.com, and my people will get the message to me, and I'm very responsive. If you will hear from me within 48 hours if I'm able. If not, just know that you're on my list.
Awesome. Beautiful, beautiful. And I'm going to put a comment, tag you on Facebook and LinkedIn and all of the good things below. So if you are interested in even continuing this conversation, it will be below. But I want to jump in to nursing because you see the state of nursing. You've been a nurse for a very long time
Come
and you
on,
are
can
a
you believe
champion.
it? Oh,
And you don't look it,
oh
but you
my
are a
gosh, like over 20
champion.
years, I think. I
Yeah.
stopped counting.
Yeah. Well, you don't tell them because you're going to tell your age. So we don't want you to tell your age. You keep looking 20. But I wanted to talk because you sit on the Florida Center for Nursing. You guys are doing amazing with really looking out for nurses. Just the situation. You've been in education. Tell us a little bit about what's going on with nursing education. Why are nursing educators the least paid? I just don't get it. What is going on?
Oh man, you throwing a monkey wrench in there. I don't know. It depends which hat you want me to wear. Do you want me to wear the academic hat from when I was a dean, or do you want me to wear the Florida Center for Nursing hat?
We're the Florida Center for Nursing hat. I like it. It's
You,
spicy.
oh, it's spicy. Well, the thing about, nurses, why they get paid less, I think we need to look at, if you compare, if you look at teachers,
Mhm.
okay, they're the most valuable profession. And what happens to their pay?
Yeah.
Okay, so if you really think about just education in general, right? We know it is so important, yet people are not paid what they are worth.
Mhm.
And because of that, of course, is going to impact the people staying in
Mhm.
academia to teach,
Yeah.
correct? um,
Yes.
and then we know that for you to teach, all you need is a master's degree.
Mhm.
But the higher you go, of course, the more value, as far as the dollar, it is put in.
Yes.
And we have been dealing with this forever. When I was a dean as
Yes.
well, it's very hard to keep nurses who can make so much more money at the bedside versus teaching and academia. But we're just hopeful that that will change, that the value of nurse, a nursing professor, nursing instructor will be highlighted, that people will have no other choice but to change policies and provide the resources that the schools need so that they can pay the experts, right?
Yes. Yes. I love, I think, I love what you said. I love, did I lose you?
No, I'm still here.
Okay, I love what you said, and that's you're bringing it down. This is what I love about you. You bring it down to a real. Um, this is just education, and this is across the board. I have a question for you though. What do you think nurses who want to be leaders? You have mentored so many nurses. And in your presence, I'm sure a lot of people have been touched and impacted by you. What are some words of advice you would give to nursing leaders who are coming up, who want to make a change in education, a change to holistic care, or just whole care of the patient? You have your hands in so many different expertise. You sit on the board of a hospital. What are some things you can say to just nurses who want to be leaders?
You know what? Everybody think that they need to be a leader to lead.
Hmm.
Okay. And leadership, the umbrella of leadership is about just doing. One of the biggest shifts that I think need to happen is that we need to stop waiting for permission to lead.
Mm,
Nurses are the backbone of the healthcare system. We know what patients' needs are, right? We know where the gaps are. We can bring compassion to everything we do, but too often we doubt the power of being a nurse. So if we think about, we need to shift our mindset to I am just a nurse, so I am the nurse.
I
you know,
am the nurse.
the nurse.
Yeah.
Nursing is the largest healthcare profession in the US, right? 5.2 million of nurses. Okay, these are stats from 2024. Can you imagine if we actually got on the same page to move and one accord? We don't have to wait to lead.
Mm.
We are the nurse. You know what's needed. If you find something that is needed, just move.
I love that. And you know who you're talking to. You know I'll be moving. You know I'll be moving. But we want to move together. And we want to move with we want to move where I'm just the comments are coming in. Let me put it up. Let me put it up. Welcome Kelly, welcome Kelly from Chicago, and then Rukaya, welcome to our show. We having a juicy conversation here. But I love this because when we get on here and we start talking to our fellow nurses and really showing them about the impact and the power that they can have, it's not just here in the US, it's all over the world.
It's global, yes. And
And go ahead.
we say one thing, right? We,
Hmm.
of course, we wish that we could move as a unit, but sometimes you got to have that one that
Yeah,
leads the unit.
yes.
You
I,
got to step out.
yeah. With I'm not even just asking permission.
Mhm.
Sometimes we need, could I do this? Should I do this?
Mhm.
And we know when you're working for certain organizations, you have limitations depending on your post. But to do good,
You don't need
you can spark a fire to do good any day, anytime.
Yeah, you don't need permission to do good,
No,
right? Because you
no.
already know what's required of you. You don't have to step outside the boundaries if you are working within an organization, right? You could still do good within the boundaries, but it
Mhm.
requires you to move. And sometimes moving means that, hey, I got to do a little bit extra,
Yes,
you know?
yes.
So, yeah, no, I love it. I love the fact that we are empowering nurses to be the nurse, not just a nurse.
Mm-hmm. Now, Dr. Lewis, you have a very packed schedule. How do you find time to avoid burnout, to take care of yourself, as well as all the different responsibilities? You are a mom, you're an educator, you are a businesswoman, right? You wear all the hats and do all the things. So how does Dr. Lewis take care of Dr. Lewis?
Oh my goodness. So I was in the office the other day, and one of my providers, my office manager say one of the providers was like, "Where is she? She better not be on to another spa." you know, and I would be lying if I don't say that I don't stretch myself thin,
Mhm,
right? I would be lying if I don't say sometimes it's so heavy that it weighs on me.
mhm,
But you have to be able to listen to your body. You
mhm.
can still do great works within the limitations, but you have to pause.
Yes.
You have to stop. You
Mhm,
have to take a break. And that break may not be a whole entire day. I don't care what that break looks like for you,
mhm,
15 minutes, 30 minutes, an hour, but you have to make time to fill your cup
mhm.
because you can't give from an empty cup. And usually, when you're giving from an empty cup, that's where burnout happens.
It's true. It's
Okay.
true.
So I can give a lot of what I have, but if I don't give myself some of it back so that I can fill
Mhm,
you back up, then what am I doing, right? You're not
mhm.
getting the best of me. And if I'm not able to give the best of me, then I'm not giving any of me. So what I do is that I stop. Sometimes I have to have hard stops. And like I said, it could be whatever an hour, or it can be, hey, the next 2 hours, I'm going to the spa. I'm going to get a facial. When everything is coming all at once,
Yeah.
before you get overwhelmed, before you get to the burnout stage, recognize your needs and do what you need to do to meet that need.
Beautifully said. Sometimes a lot of us, we are in the system, we get burnout, we pursue a holistic course. And what I'm realizing is that when you have a lot in you to give, and I believe most nurses, if not all, have a lot to give, you have to find ways where you can serve and still feed yourself.
Mm, mhm,
And
mhm.
I really admire seeing you because whenever you show up for the meetings for the Florida Center for Nursing, and also you represent your business so very well, you're also in touch with the community, you're a woman of faith, you have so many things on your priority list, yet still, you're still there. You're on your list.
Yes, you have to be. And I'm so glad you brought that up. And I'm passionate. What we do when we wake up, we create a list of all the things that we need to do or what our priorities are. And sometimes we forget to add our name to the list, right?
Mm,
And yeah, we know burnout is real. It's not a weakness, it's a signal. It's telling that your mind and body is saying, pause, something needs attention. So take the break, recenter, refill your cup, talk to people, right? Say no without feeling guilty. No is the best two-letter words you can learn to master in life. And yes, talk to even a therapist. I have one. My psychologist is just a text away. All right. You have to be able to say these things and acknowledge that you need it too.
yes.
Add yourself to, if you are in a space right now, and I'm just going to stop. If you are in a space right now where you are not part of that list, I want you to add your name to every list that you create
Mm.
until you get to the point that you're able to make it a priority.
That is beautiful. You know, so many times we work off of a calendar, but we are nowhere on the calendar.
Mm-hmm.
Everybody and everything, and especially as a nurse, you know, I am a nurse, I'm a holistic coach. So I coach a lot of people, and I notice that sometimes even getting themselves to coaching is really hard. We're here, we're always here for everyone. We're
Mm-hmm.
always present, we show up. But when it comes to us, we are last on the list and first to go.
Mm-hmm. Exactly. Because what? We came into nursing for what? For the most part, most people go into nursing because, you know what? I want to help people. We
Mhm,
have that desire, that passion to help others, but we
mhm.
fail to realize that if we don't help ourselves, we're not really helping others. And that's what leads to burnout a lot.
It is. It is. You know, I work with Primerica. I do financial and leadership classes for women in the community. And
Mhm.
I often say, just in the financial world, you want to invest in things that appreciate. Sometimes we forget that's us, not just real estate appreciate. We appreciate too, right? And as people that appreciate, what are you putting into your mind? Sometimes it's
Yes.
not just about breathing deeply, but what are the things are you constantly learning? Are you in an environment that nurtures your soul and sets your spirit free? That is not just by accident. You have to create it. You have to intentionally put yourself
Mhm.
in the rooms, in the places, in the
Mhm.
spaces that's going to grow you and stretch you. Right?
Mhm.
But
Mhm.
that is appreciating yourself. So many times I see as nurses, we are depreciating because we're not eating right, we're not taking care of ourselves,
Love
we're,
it.
just
Yeah.
depreciating our bodies. By the end, we just go sit down next to the patient we're caring for, right? Me next. Right?
And I love the way you use, the value added proposition to appreciate appreciation.
Mhm.
When if there's appreciation, what happens? Your value increases.
Increases.
Okay. And many times you feel you are in a depreciating state when you get to burned out. And I'm
Mhm.
glad you stated that, you know what, we have to value ourselves enough that we can also value others. We have to make that time. And thank you for bringing your expertise of finance and leadership, and your holistic coaching, because it helped us to really, really understand wellness from a different viewpoint, a different perspective.
It does. It does. And you know what? I'm glad because I really should be wrapping up, but I think this is really worth sharing. Donna, I hope I'm saying your name right, or Danya, it's a pretty
Anya.
name. She's a nurse, and she said she had to be in therapy for a year after
Mhm,
serving during COVID. She
mhm,
was pretty broken. And I
mhm.
really want to honor that. Thank you for sharing that on our platform here. Um, could you speak to Dr. Lois, the impact that COVID had on the mental wellness, well-being of nurses?
Oh my goodness. I mean, like, I know we kind of have beat that conversation to death, right?
Mhm.
We know if COVID taught us anything as nurses is to what? Make sure that we take care of ourselves because COVID burned you out. It
It
burned a lot of our nurses out to the point that some of our nurses are still recuperating.
Yes.
It's what, 5 years later, right?
Mhm, mhm,
And not only recuperating, there's things that nurses saw that they cannot get rid of,
mhm.
right? There was a lot of tragedy. And I'm so glad that Danya went to therapy. She recognized she needed therapy because what do? We just keep rolling, we just keep going, right? And we don't realize that if when this is a time where we need to pause and we need to get into therapy. We
Mhm,
need to speak to someone because what we experienced was trauma.
mhm.
Okay. I mean, post COVID traumatic syndrome. It was trauma. A
Yeah.
lot of nurses experience trauma.
Mhm,
And you have to walk through the trauma so that 10 years, 30 years, 40 years down the line, it's not hitting you at a different space in your life. I do a lot of trauma work with my patients.
mhm.
And I'm telling you, I see what happened to them as a child, really the impact of it in their 40s, in
Yes.
their 50s, and not realizing that if I allowed myself to get the help to just speak to someone about the trauma I experienced,
Mhm.
that I would be able to just live the life that I worked so hard for, right? 10 years later. So yeah, it's still attacking people,
Yes. Yes.
right? People are still working through the trauma. So
Yes.
it's not too late. That's what I want to say. It's not too late for us to tap in and get the help we need and process some of that trauma.
It's not too late, and the time is now. The
Mhm.
time is now. As the world is moving on, you have to stop and take care of yourself. You know, Dr. Lewis, I could talk to you. I don't know why I put this thing for 30 minutes. We could talk for a full hour. And you see, I didn't stick to none of the questions I say I was going to ask you.
Oh, and but that's when you have a genuine conversation, when you have a genuine connection, and when you ask for God to lead,
Yes.
sometimes the questions come
Yeah.
in the way for the people, for the audience that need to hear it. So
Yes.
it's always a beautiful thing because we never want to be on script.
We never want to be on script. And you know what? I'm going to have you back because there's a lot in you that when I sit with you, I feel so honored that I can even have a one-on-one with you. But most people, they won't have that opportunity. So I feel like I need to bring it all out so that the world gets to know how amazing you are, the impact that you're having. I just want to say shout out to Ningsha. He's connecting from Cameroon. Welcome, Ningsha. Welcome to our show. Thank you, Dr. Lois, for being here. I appreciate all of the work you're doing, all of the prayers that you say for your patients, for the nurses, all of the appreciation and the gratitude that you have for current leadership, for current what's going on in nursing right now. You are not just talking or complaining about it, but you're always showing up and advocating, whether it's for mental health, for nurses' well-being, for more pay. You are there. So I'm just so yes, too much to say. We could talk all day. Yes, Danya. But I do want to stick with it because every week I'm gonna be on here at 4 o'clock on a Sunday. So I thank you for joining. We will have you back.
Oh,
Any last words? My voice is going, but any last words for the audience?
you know what? Just take care of yourself. Don't forget that you don't want to be that patient. So while you're giving so much of yourself, give yourself something back. All right. I think that is it. Thank you so much. It's an honor and pleasure to be here. It's an honor and pleasure for the work that God has instilled in me, and to be able to do the things I have done. It's not of me, it's because of Him. So, all honor and glory to God for allowing me to be present and work in the spaces I've been worked in. When I look at me, and I know we talked a little bit about leadership, and I know I say this was the end, but when I look at me and I look at my life, and people look at me and say, Dr. Liz, how you were able to do all these things? Because there was a different hand leading and guiding me. Okay, at 40 years old to be the dean. Okay, and to be in the spaces that I never imagined that I could be in. That's what I say. Leadership is starts wherever you are. So,
Mm.
who's a nurse? We need you. We need you so much, and we need you to be healthy. And we got to remember that mind controls every organ in your body, and you know that. So please take care of yourself.
Mm.
Give you some of you. So
Mm.
fill your cup so that you could have more to pour. Thank you so much.
Thank you so much. Thank you for being on, and we will see you next time. Thank you, audience. We'll see you next time.
Thank you. Bye bye.